As doctors, we have an ethical responsibility to look after our own health and well-being.
We must look after our own health. If you have concerns about your health or the health of a doctor you know, please ask for help or offer to a colleague who's struggling.
Talk to your GP or family doctor. Talk to an occupational health physician. Make contact with support services supplied by your employer. Make contact with Practitioner Health Matters Programme, or make contact with the Health Committee of the Medical Council.
Another useful thing to think about is the supports that are available in your hospital or institution. For example, the Employee Assistance Programme or your Occupational Health Department. Both of these provide a confidential and independent listening ear that can be really helpful if you're feeling under stress.
As doctors, we have an ethical responsibility to look after ourselves physically and mentally.
If you haven't got a duct or chyle, it's really important to register with a general practitioner. There's a list of practitioners in your area available on the Irish College of General Practitioners website.
Make sure you take regular work breaks throughout the day. A full lunch break and an organised short break throughout the day will leave you in a stronger position when meeting your patient's needs.
Leave your work desk for at least 15 minutes. Walk around the block, walk up and down the stairs if you have to.
If you're feeling overwhelmed, do seek assistance from your work colleagues in order to ensure that the workload is evenly spread.
Make sure to seek support for mental health issues such as anxiety or depression.
I think something that also helps me is trying to take breaks while you're in work, although I know it's very challenging to step away from your clinical practice and patients. But taking time to sit down and eat something nutritious or have snacks on the go, because it's very tempting on call just to live off tea and toast.
Drink water regularly throughout the day to ensure that you're adequately hydrated. Use fitness apps on your smartphone to record and set daily targets for walking or for steps.
As doctors, it's so important for us to take care of and to prioritise our own physical and mental health. If we aren't healthy ourselves, we won't be available to take care of our patients.
Ensure 30 minutes of exercise per day, such as brisk walking. This can be done by walking in part, cycling to work, or going for a walk on your lunch break.
As doctors, we have an ethical responsibility to look after our health and well-being. A consistent and regular sleep pattern is necessary to prepare body and mind for the next day.
Find something that works for you and just go for it. For me, it's a variety of things. I love being outdoors and I love exercising outdoors.
If you walk or jog during normal circumstances, it is especially important to continue to do so during stressful times to ensure good mental health.
It is important that there's a positive working environment and collegiality in the workplace.
During this stressful period, I'd encourage all my colleagues to take time to have some form of activity or exercise. It's important that we offer support and show strong collegiality.
Now, more than ever, it is important that you take care of yourselves and each other. It is only through looking after our own health first that we can best care for that of our patients. I ask all doctors to support each other and your colleagues, but most of all, I urge you to look after yourselves.